I'm Cassandra LeBlanc with Shape of the City. 1 in 4 deaths in America are due to heart disease. Today, I'm speaking with Dr. Bob Rauner from Partnership for a Healthy Lincoln to learn how we can better take care of our hearts. So, Dr. Rauner, we often hear about heart health. Can you tell me a little bit about that?
Well, basically, heart's kind of important. That's what pumps all the blood, and if it doesn't work, we're done. And so the question is, what keeps your heart healthy? And there's a number of things that kind of go into that. People often know about genetics. They don't realize that actually the biggest things are actually things within our lifestyle. So the things that keep your heart healthy are just, one, sometimes avoiding things like smoking and vaping, for example. Nicotine is probably one of the worst things for our heart health. Although it's actually not the most important now. Actually, they're saying sitting is the new smoking. That actually lack of physical activity, or on the positive side, being more physically fit, is even more predictive of heart disease. And I think some people saw in the headlines a few weeks ago that there's a huge national increase in heart disease, and Lincoln was the fourth worst increase. And so the question is why? And a lot of it boils down to fitness and diet, and unfortunately maybe the rise of vaping. So it seems like a big increase was actually in the younger population. And so maybe our older people above 65, heart disease hasn't gone up a lot, but it's gone up a lot in the 30 to 40 to 50 range.
Yeah. So you told us a little bit about some of those key life choices, but can you go in a little bit more about what are those risk factors?
Well, fitness is, like I say, is the biggest one, and fitness is more than one component, and that kind of confuses people a little bit. Like, is it steps per day, for example? Well, actually, yes, and there's pretty good evidence, depending on your age, anywhere from 7,500 if you're older to, if you're young, maybe in 10, 12, or 15,000. You just need to give that a cumulative amount of exercise. That's also not just for your heart, that keeps your bones healthy too, and your balance. But it's just not steps alone, it's also intensity of exercise. So you need to get your heart rate up pretty fast, because that's what builds up the reserve. There's even some studies showing that if you adjust for the aerobic fitness on a treadmill, sometimes your weight actually doesn't matter, meaning you can be overweight, but as long as you can get to this higher level of physical activity, and they use a term called 10 METs, that if you can get to that, actually that gets rid of most of the negative consequences of your weight, but that needs some intensity. And the reason that helps is if your heart can do 10 times what you can do at rest, if something bad happens like a heart attack and you lose half of your heart's ability to pump, but you still have 5 times left over, that's what allows you to survive a heart attack. Or if you fall and hurt yourself and have a broken bone, or you make it through surgery, survive a car wreck, you need that extra heart reserve to be healthy. The other thing is something has to do with what may clog up your arteries, so like cholesterol and things like that. Partly that's a duration of exercise. So you also need to exercise a certain amount of time, 20 to 30 minutes at a pop. And the reason being is your muscles store enough energy so they don't really change your metabolism until you start exercising more than 20 to 30 minutes. So intermittent 5 minutes doesn't always get there. You need some duration as well. So it's kind of a combination of getting enough steps per day and not sitting too much. It's getting your heart up to a high rate so you have some reserve, and then enough duration so you change your metabolism a little bit. And so all of those things kind of go into the physical activity side.
Yeah. And that's a lot of information. Thank you for that. So that definitely leads me to believe that those are ways that we can reduce our risk of heart disease. You mentioned about the Wall Street Journal, and I did see that article, and I saw that I want to say the ages was between 45 and 64. Do you have any specific advice maybe for someone in that age group about what they could do? I know you mentioned physical activity, but maybe one more thing.
Another thing is diet. We're getting way too much sugar in our diet. And so actually cholesterol was a little overblown in the past, and partly that was a diversionary tactic from the sugar industry. There were even some lawsuits potentially about that, where some studies were done and not categorized correctly because of payment by the sugar industry. And so it turns out that sugar is bad for your heart, and maybe even artificial sweeteners too. And so it's also what you eat. Fruits and vegetables are very much important. It's kind of a displacement. If you're not eating sugars, hopefully you're eating fruits and vegetables and nuts and things like that. And so your diet can make a big difference. Blood pressure makes a big difference. You have high blood pressure, getting your blood pressure controlled. And then diabetes is a big risk, which also ties back to bad diet, too much sugar, not enough exercise. And genetics does make a difference. Maybe 20 to 30% of the difference is genetics, but really lifestyle is the big one. And then again, you can't forget about smoking. We made huge gains in smoking in the last few decades. Unfortunately, some of that's been reversed by vaping. And vaping doesn't have that cancer risk, which people think they always associate that with smoking, but actually most smokers don't die from cancer, they die from heart disease. And all of that is there, and maybe even more so in vaping. And one of the explanations of why vaping might actually even be worse from your heart is that cigarettes kind of slow down how fast you can take the nicotine, whereas vaping doesn't control that dose. It's kind of like you can get drunker on vodka than beer sometimes, and it may have that similar effect. So we have to think about vaping, and unfortunately that kind of came under the radar, and the vaping rates, especially the younger, are really worrisome.
Yeah, vaping definitely took over fairly quickly, and it's definitely affected our youth. So thank you for bringing that up. So I just have one more question. You know, what if we have a viewer out there that really wants to know what they can do to learn more about their heart health, or if they want to learn where to get any information? Do you have any recommendations for that?
Yeah, I mean, a couple things to do. One is a lot of employers have employee wellness screenings, for example, and they calculate some of these same things. They'll actually sometimes have a health risk assessment. Are you exercising, for example? Do you smoke? They'll check your blood pressure. They'll check your cholesterol. But then, okay, you have these abnormal results. If you have them, what are you going to do about it? And so the ideal ones is you take that into your primary care doctor and say, okay, what are these risks? What is important for me? What should I prioritize? And then sometimes with behavior change, don't do too much at once. So like if you're someone who averages 3,000 or 4,000 steps a day, you're not going to get straight to 10. So you can monitor that just slowly and say, well, I'm 4,000 now, maybe next week I'll try to get to 5. After that, I'll get to 6. And so a step counter can work. Some smartphones actually have an app, and if you look at it, you'll find that actually it has been tracking if you're wearing it, and so that can give you a way to monitor. And so I think those things, because it gives you immediate feedback, and I can look at that and say, well, you know what, I was getting 10,000 steps this week, but now I'm getting 8. Maybe I should, figure out what did I do different. And it's a little hard in January and February where if it's icy out there, you might not exercise. So if you can't afford it, you go to a mall, for example, like South Point, or maybe it's not outside, but some of the other malls that are indoor.
Gateway.
Gateway. A fitness center might work. Some community centers have walking paths, for example. Even schools sometimes after hours may have something. So there's a lot of options if you can't, but trying to figure out how do I get out when it's cold outside like this.
Yeah. Okay, well, Dr. Rauner, thank you so much for all this information today and taking the time to speak with us at Shape of the City.
All right, you're welcome.